Okay, so just a couple other things to be aware of. If you are the non-dissecting person, okay, and you wish to point something out to your lab partner who may have trouble because you are following the directions and they're doing the dissecting, you will not be wearing gloves, right? So you would have a ungloved hand. And you can use the probe and point out and say, I think this is the chordae tendineae. Yes, it is. I think there is the apex, to help your partner, because the pins have been touched with gloves and you do not want to touch them without gloves. So you need to have a partner without gloves on who can use either the pointer, the probe like this, as a pointer. Point that would be the aorta. There is the left atrium. Or alternately, you can use the tweezers if you need to grab something or point. Either tool is okay for that, okay? If you wish to, you can use this hand lens magnifying glass to get a closer view of some of that amazing heart structure, okay? Especially the chordae tendineae, and inside the right and left ventricle. It is very interesting. And also looking at the structure of the heart muscle itself that we cut through. This is a great tool to do that. Okay, so definitely make use of it. All right, so again, that is what is available for the partner who is not gloved. Okay, the gloved partner is the dissector, right?